You are watching the DocTalk Show.
Welcome back to the DocTalk Show. I'm here with my panelists, Dr. Angelica Etima and Dr. Kasule Umar, who are experts in the field of medicine called ear, nose, and throat. And we're talking about the subject of foreign bodies lodging in these body regions of the body. So you probably experience an encounter where a foreign body has lodged in your throat or in the nose, or it might have happened to someone who you've taken care of, for example, a child or an elderly person. There are common objects such as coins or beads, food particles like beans or peas, or large meal boluses such as meat. You might be feeding your child with let's say a piece of meat and suddenly get stuck in the throat. So this topic is to discuss the issue of foreign bodies occurring in the ear, occurring in the nose and the throat. And with me are Dr. Umar and Dr. Angelica. So I'll turn again to Dr. Umar. How can one know that a foreign body is lodged in the nose?
Well, depending on how old our patient is. For children, some that may be able to talk may say that, you know what, I have put a foreign body in my nose. And they would report to their mothers.
If they're playing with something, then they
plain and simple. And then that's when intervention will start. Okay. To others who can't actually say, most of the times parents see those things. Because they keep checking. It's an innate thing about parents, especially mothers, to look at their children and look in their nose, look in their ears, find out how they're doing. It's a common thing, and it's something we encourage. Sometimes foreign bodies are found naturally like that.
How about if it's like not a parent, like you're walking on the street, are there signs you can
usually
see?
maybe not. Maybe sometimes you may not see anything at all. Okay, but at the time when these foreign bodies are being put, sometimes they may be bleeding. Okay, so if you are in the midst of a child who is placing a foreign body within their nose, for example, they might bleed. Okay, and then you would see that. But most times this is so subtle or silent that a foreign body may be placed in the nasal cavity and nothing gets to be understood or known. Okay, so what pathognomically you would see, what you would see.
What does that mean?
What are the things? What is that clear sign? Okay,
the one thing that
would point you to a foreign body in the nasal cavity.
What
okay?
is it?
Usually, children will come with unilateral smelling of the nose. Okay.
Unilateral
mean one side. Okay, like one nostril is smelling and it has a bit of a discharge and it's yellowish. It's old. You would differentiate between a new discharge, which is mucus and it's clean, with the one that is old and stuffy, and So usually they present with this, and that is usually the cardinal symptom, the real thing that you see. Okay, and then in the end, what would happen is that if still that is not seen, all patients do not present entirely like that. When they go to bed, they start snoring suddenly. The child who was awake, who was okay earlier in the day, when they go to bed, there's a sound that you feel. Okay, it simply means there's blockage in the airstream. How this child is breathing, it's being impeded at some point, and then you pick up the snoring, and that could only be the reason why you would see this patient.
Okay, so bleeding, abnormal discharge, or snoring could be signs of
a foreign body.
In the nose.
Yeah, and sometimes it's coupled with a fever. They might run a fever after 2-3 days, depending on what kind of foreign body it is.
Okay. So how about the throat, Dr. Etima?
So,
is there any way to tell that a foreign body is in the throat?
Yes, there are signs that you can pick up to tell that there's a foreign body in the nose. Like we earlier said, there are two systems in the throat: the breathing system, or what we call the airway, and the food system. So if this foreign body is in the breathing system, it's usually a dramatic presentation. You'll have sudden onset of choking. The child or even an adult, you start to cough irresistibly because your body is trying to eliminate this foreign object from the sensitive area of breathing. You may have a change in the breathing itself. You start to breathe with difficulty because there is something in the breathing system, which is not supposed to be there.
Something is blocking the airway.
Exactly.
Passage of air.
Yes. And remember, this breathing system has tubes. So even when you have something within a tube, let's say if you're supposed to blow air through a tube, and then you blow it without this object in the tube, it will flow freely. But when you have something in the tube, there will be a bit of resistance. So you'll have difficulty in breathing. You may have a change in the sound of your breathing. Because right now we're all breathing, but you cannot hear us breathe.
Breathing is
So
supposed to be a quiet.
it's supposed to be a quiet and like passive thing. But this person will start to have noisy breathing. In medicine, we use terms like wheezing. We use terms like stridor. So someone will be able to perceive that this is a person or a child that is struggling to breathe.
Okay.
When it gets even worse, you may have complete cessation or like a stoppage in the breathing. Someone will stop to breathe, and this is usually a bad sign
That is
because
like really the end.
it shows that now this obstruction is becoming worse. So if you look at this person, they may turn a bit bluish on the lips, because our lips are supposed to have a bit of a pink color, and this pink color shows that oxygen is reaching the extremities, or like these other parts that are not close to the lungs.
Not to say the pink of lipstick, but
No, but the natural pink, the natural pink.
Also,
So you'll
within-
notice
within
that,
the mouth.
or even the tongue itself can turn a bit blue. Okay, the child will start to feel a bit cold on the what we call the extremities, which are the fingers and then the feet. All this is happening because this child is not getting enough oxygen. Child or even person. I have a passion for children, so I'll always refer to children.
Okay.
They may start to sweat. Okay, they may start to sweat suddenly, and these are all signs of a drop in the amount of oxygen that is going to this person. They may have, they may go into like a state of being in coma, where they're non-responsive. And there it's really getting bad. Because like we said, this can actually end up in death. We've seen it happen, and it's something that we cannot take as a simple matter.
Oh. So you talked about the throat being divided into the airway and the feeding system.
Yes.
So Dr. Omar, in the feeding system, are there signs to tell the foreign body is lodged there?
Yeah, most important in what you would find for a child is that they have a history of having been playing with something, this kind of object. For example, if it is in the airway, they would say, we were doing something with the beans or maize or peas, okay? And suddenly, and we think this child had something in their mouth, and suddenly they were either scared into doing something, okay, or they were suddenly started laughing, something,
Or even playing.
or started playing and running around, okay. Those scenarios where the thoughts are taken off something that is within your mouth, okay. That is the scenario where you get to have a foreign body lodging in places where it shouldn't be. Now, if it is in the throat, okay, you would suddenly feel there's something in your throat, okay, whether it is an adult or a child, okay. Mostly for adults, it's things to do with food, okay. I've seen patients coming with pork pieces there, yeah, pork.
And pork is a thing which is commonly
It's a delicacy here, right? So, but it's a common thing. I've seen pork pieces in lump sums getting stuck in the throat, okay? They would have fish bones.
Yes.
Commonest is fish bones, okay? You would have those things lodging there. Now, in the attempt to clear, for the airway it would be coughing, because it's clearing, it's air. But for this part that swallows, you'd want to vomit out something. So you get nauseated, you start vomiting, okay? And because there's nothing going inside, you feel a lump, okay? And then you can't even swallow the saliva.
Yes.
Yeah, like it's getting bigger. Although in actual sense it's not, but it feels like it's getting bigger. Okay? And then you start feeling like saliva is collecting within your mouth. And in the end, it starts drooling. So because you can't swallow, you keep spitting all the time, and you start getting painful swallowing when things are settling. Sometimes it may go down further, then the symptoms reduce. You remain with only painful swallowing and none. But then when it's still high up, the drooling continues.
Yes.
And that drooling means that you're losing a lot more water or fluid from your body. Okay, and you're not taking in anything else. So it can help set up the dehydration that we talked about.
Especially in children.
Much faster.
Yes, especially in
So
children.
it can be a very drastic presentation.
Yeah, it
Yes,
can.
it
It's
can.
very sudden, depending on where it is, if it's in the nose, if it's in the
In the throat.
throat, going to the airway, or going to the
Yeah.
food system.
Yes.
You are watching the DocTalk Show.